Well, good morning, Dr. Brian McKay, not just a chiropractor, Stanford Darien-Dr.Brian. As always, apologizing for the worst possible name in existence for a podcast. Anyhow, let me ask you a question. Are you a woman experiencing hip pain? Well, you're not alone. Studies have shown that women are more prone to discomfort compared to men, and it's kind of important to know why. We're a little bit different, we're built a little bit differently, but in this case here, we're going to delve deeper into the factors that contribute to a woman's increased risk of hip pain and get an understanding on chances are more likely to have a hip fracture. So let's just get right down to it. All right, when it comes to understanding hip pain, the underlying factors are crucial in taking proactive steps towards relief. Makes some sense. One of the factors is between men and women is the anatomy. Women have a unique hip structure that makes them susceptible to more pain, discomfort, and potentially surgeries later on. And additionally, hormonal fluctuations play a role in hip health, as the changes in estrogen levels can affect the bone density and joint stability. So, women don't have it easy, do they? I don't think so. And believe me, we got to give a lot of credit for bearing our children. But there are preventive measures that you can take, and we'll go over those as well. I mean, obviously, it's maintaining a healthy lifestyle, making sure you're wearing the right footwear, exercise, weight, keeping your weight under control. These are all things that make sense on every single level of living, but even more so when you get hip pain. So the significant factor is well, probably is the difference in anatomy. Okay, that's probably one of the things you want to take a look at mostly. And I think why don't you know what? Let's backtrack. Hormonal changes play a role in women's susceptibility to hip pain. During the menstrual cycle, pregnancy and menopause, hormones can affect the ligaments and the joints' laxity. This increased laxity can make the hip joint less stable, more prone to injuries and inflammation, and they can lead to pelvic pain and discomfort around the hip area. So it kind of makes sense. You got these hormones floating through your body, and they're interrupting the ligament's ability to stabilize and attach bone to bone. And that's going to change during menopause. It's going to change during childbirth. It's going to change during the monthly menstrual cycles. So that's a really big factor, um, very big factor in terms of hip pain. Now let's go to reproductive factors. Childbirth can cause physical changes to the pelvic region that can lead to potential hip pain and instability. As the uterus, as the baby's growing inside during pregnancy, it puts pressure on the surrounding structures, including the hips. And in addition, during childbirth, there's the stretching of the birth canal, which is in the pelvis, which is near the hips. So you have those changes going on that can play a significant role in having some significant role in having hip pain. You know, so there's some listen, as a chiropractor, I can treat a lot of hip pain, and actually, it's probably the quickest way to do it. I mean, it's nice to be able to strengthen those areas up, but I think the strengthening part should be part of your regular routine, no matter what. I mean, you don't just strengthen the hips, strengthen the whole body. The chiropractic adjustment is a really big way for us to stabilize the pelvis and take pressure off these ligaments if the ligament laxity is due to hormonal changes or the reproductive changes. So it kind of makes sense. I mean, it's probably the fastest, easiest way to get someone out of hip pain. Now, someone's a little bit older and they have hip pain. It could be osteoporosis. It could be, a very weakened hip. I've noticed when I go out shopping at different places, you see how women, like have a lean or a certain walk that really is detrimental, and it puts extra stress onto the pelvis. Well, that's not good either. But that's where a lot of times they say a chiropractic visit can save you a lot of trouble down the road. So it's kind of if you think about it, it really is a physical thing that could be mitigated by the adjustment alone. Another area that we really got to touch upon is the fact that you know footwear is a big, big player. And if you're going to wear high heels, guess what? You're probably going to have some serious pain. I mean, a high heels is just not a good thing. Sure, they look good. Believe me, I think they look good. But what happens is you really need to understand that your footwear plays a big role in stabilizing the pelvis. And a stable pelvis is a happy pelvis. I'm sure that makes a lot of sense. Now, I'm not so sure if you've ever heard of a thing called the Q angle. Well, if you've never heard about the Q angle is kind of a measurement. Well, it's actually a knee measurement, but it also measures the distance between the pelvis on each side, the pelvic width, and it's believed there's more issues with women with hip sports related injuries because of the Q angle. So it highlights the difference, the biomechanical difference between men and women, and so that's one of the other issues here. But it also it gives you information about the knee because if the knee is off, it can put the pelvis off. So it's the same thing with the foot. That's why we say talk about the footwear issue. Make sure you're wearing good shoes, solid, supportive shoes. And the other thing too is know that it can affect the knee joint and then the Q angle as it relates to the hip. First of all, the Q stands for quadriceps. You know, so the wider the hips, the greater the Q angle will be, with the thighs, angling more steeply towards the knees. So, it'll put more strain on the knees. But the knees, especially the quadriceps, are going to insert into the pelvis at the hip joint. So I think I've thrown enough on this topic to you. I hope you get a better understanding about why women have more hip pain and hip problems, and ultimately later on in life, hip fractures. In any event, I'm Dr. Brian McKay. You got any questions? Give me a shout. 203-656-3636. 203-656-3636. Have a wonderful